This is Dr. Christopher Sendy with Nova Health Recovery Ketamine Infusion Center in Alexandria, Virginia, and I'm going to discuss how to start oral and intranasal ketamine therapy for depression at Nova Health. So the first question is, are you a candidate for ketamine therapy? So do you suffer from treatment-resistant depression, anxiety disorders, bipolar depression, and yet wish to avoid traditional antidepressants, obsessive compulsive disorder, post-traumatic stress disorder, chronic suicidal ideations, or postpartum depression? Likewise, do you have a chronic pain condition such as cluster headaches, trigeminal neuralgia, neuropathy, CRPS, phantom limb pain, or other types of neuropathies? Then you would be a candidate for ketamine therapy if you suffer from any of these particular problems. Now, the other question is, do you have any medical conditions? Have you had a heart attack in the past year, or a stroke, or lung conditions such as COPD and require oxygen therapies, uncontrolled blood pressure, uncontrolled diabetes, active addiction disorder, kidney or liver failure, or pregnancy? If you have any of these conditions, then certainly we would need to evaluate you for the treatment. So some medical conditions may require medical clearance from your physician. The decision to prescribe home ketamine therapy may be based in part on medical conditions, and the dosing, frequency, and treatment plan may be altered by some medical conditions. And this is definitely discussed in the medical screening process, and when we meet up, we make some decisions on what the next steps would be. So step 2 would be to call Nova Health Recovery for a brief conversation regarding your diagnosis and medical conditions. And usually the individual will be speaking with me, Dr. Sendy. And the phone numbers you could reach us at are 703-844-0184 or 571-999-2118. And you can actually discuss with us what exactly is going on, and we can help you determine the appropriateness of treatment with home-based oral and nasal spray ketamine. Sometimes, though, intravenous infusions would be the best way to start treatment, especially when things are exceptionally severe. Now, step 3 is the in-office visit. Now, there's definitely an extensive mental health form that'll help us evaluate your mental health journey to determine the best ketamine treatment fit for your case. So it's really important to fill out all the questions completely. And then during the meeting, we do a mental health and medical integration session to discuss your mental health journey, what worked in the past, what didn't work, and how ketamine therapy can help you. We also set expectations on how quickly it may work, or why it might not work, or what we'll do to help make it last longer when it does work. And together we'll decide which ketamine therapy best fits your situation. Would it be the nasal spray therapy or oral tablets? And so once we determine the treatment plan, the compounded ketamine prescription will be sent to a compounding pharmacy. And there's several that we work with that make exceptionally good products. Now, ketamine therapy is to be used at home only, with no driving for 6 hours after use. And prescription use will vary by condition, but some may need the home therapy several times a week. So with the oral tablets, the RDTs, the troches, and the ketamine nasal spray, each of these has a different pattern of use and frequency, and also side effect profile varies slightly. But the treatment is not meant to be dissociative or trippy, but rather meant to increase neuroplasticity. As it's microdosing, you won't feel much of the euphoria and the psychomimetic effects that you have with intravenous dosing. So you're not going to have the enhancement of colors and sounds. You're not going to have synesthetic type events. And euphoria may be mild. But again, the design behind the home-based ketamine is to basically augment the antidepressant response and the anti-anxiety response. So it may take several days to start seeing the effects of treatment after you start. And many will use home-based oral and intranasal treatments after their initial ketamine infusions as a methodology of maintaining the efficacy of those ketamine infusions. Now, without the initial ketamine therapies of intravenous types, the onset of effects with home treatments may be much slower. In fact, oral ketamine may take up to 3 weeks to start to work. And the treatment length that you would use these treatments is variable for each case. And there are some people that have been on these treatments for years without any significant side effects, and the efficacy doesn't wane. What are the side effects? Well, they include dizziness, nausea, sometimes vomiting, balance issues, and brief heart rate and blood pressure changes as well that generally resolve a short time after you finish the treatment. And these all, again, resolve rapidly within a few minutes to a few hours after each treatment, if they occur at all. And there are a bunch of other minor symptoms as well that people may get, but generally speaking, the side effects are few. However, again, caution is to use this only at home and not to drive for that 6-hour period after you use it. And step 4, the follow-up treatments when the medication runs out, usually in 4 to 6 weeks. Now, sometimes people will have periods where they need to use more at the prescription of the doctor. And certainly patients can contact us again if changes need to be made in the frequency or dosing. But again, we do maintain contact with patients through mood apps such as Osmind or other types of apps just to verify that the patients are improving based on medically validated scoring systems. So again, the whole process to start home ketamine therapy with oral or nasal spray ketamine at Nova Health starts at step 1, which is determining if you suffer from any of the conditions that ketamine might help out in, such as depression, anxiety, PTSD, bipolar depression, or chronic pain problems, chronic suicidal thoughts. And then step 2 is the brief initial phone consult where you discuss your mental health history in part and discuss with us some of the treatments that you might have tried and also what we can offer, which include ketamine infusions, oral or intranasal ketamine. And if it seems like you are a good fit for ketamine therapies, then we go to step 3, which is an in-office visit and evaluation. And to start this off, we need a complete mental health questionnaire filled out with appropriate consent forms. And then we proceed forward to the mental health and integration visit to discuss your treatment therapy and how ketamine works. Finally, the prescription is sent to the compounding pharmacy, and then the person goes home and utilizes the medication. And step 4 is follow up, frequently by telehealth. So when the individual runs out of the medication, they can call us and we can continue forward with the continued treatment.